says, don't worry. That's me right here, okay? We're not getting rid of the dog. She was pulling his tail. He growled to let her know he didn't like it. I know she can't hear.
Hi, my name is Meredith Gray, and I don't have a lot of time today because I'm a very busy general surgeon. Here at Seattle Grace Hospital, sound is all around us, and if a patient is deaf, their diagnosis could be misinterpreted. If I'm explaining my diagnosis in my doctor words, then the interpreter for the deaf patient could not interpret everything accurately because there aren't sign language signs for every single word in the English language. Well, that's my pager. Got a blast.
My head. Look at my head.
Sedation, please. You need to calm down, buddy.
Hi, my name is Izzy Stevens, and here, like any other hospital, we have heart monitors. A steady beat or sound represents a healthy heartbeat. The rapid sound represents a heart going into distress. A flat line or a loud, high-pitched sound represents a heart that is no longer beating, so the patient is dying.
Scared I'll never wake up.
Hi, my name is Teddy Altman, and today we're going to be talking about the stethoscope. The stethoscope is used to listen to a patient's heartbeat. It is placed on the chest right around the heart. The sound waves vibrate the diaphragm, and the resulting waves are channeled up through the long part of the stethoscope called the tube. It is then transmitted to the headset, which is placed in the ears. Normally the sounds we hear are the results of scattered sound waves, but the tubing of the stethoscope, or the long part of the stethoscope leading to the end of it, acts to focus the waves which reflect back and forth against the interior walls of the tube, which means in the inside of the tube. For the people who don't really understand this process is called multiple reflection. This process is focused on repeating the sound waves, and it makes the stethoscope work. It also works by amplifying the sound of the heartbeat, allowing the medic, doctor, or nurse to hear the patient's heartbeat accurately.
Look, very strong fetal heartbeat.
Hi, my name is Arizona Robbins, and today I'll be talking about the ultrasound. The ultrasound, as you may know, is a device that women like to see their baby through. In medical terms, the ultrasound is a medical imaging technique that uses high-frequency sound waves and their echoes to produce a picture on a screen. It uses a probe to transmit high-frequency sound pulses, 1 to 5 megahertz, into your body. When the sound travels into your body, it hits a boundary between the tissue and the waves get reflected back to the probe. The reflected waves, when they are picked up by the probe, and send it back to the machine. The distance from the probe to the tissue or organ is what the machine calculates during the speed of sound in the tissue and the time of each echo returns. When the distance and echoes are shown on the screen, it displays a two-dimensional figure or picture. Two different kinds of ultrasounds are a 3D ultrasound, and that shows a 3D image of your baby if you want to see it, and there's also a Doppler ultrasound. The Doppler ultrasound is based on the Doppler effect. When the object reflects the ultrasound wave while it's moving, it changes the frequency of the echoes. This creates a higher frequency when it is closer to the probe and a lower frequency when it's farther away from the probe. Some of the uses of the ultrasound is to obviously see a baby, but it is also used to see in women if they have ovarian cancer or breast cancer, so they can find tumors. And it can also detect prostate cancer early. And it is also used for the heart to see if there is any abnormal mass. It is also used to find kidney stones and to see the blood flow through the kidneys.